Great. Thank you so much. Good afternoon, everyone. And thank you for joining us today for our webinar on assessing organizational ability to provide navigation services. Next slide. This is the first webinar in a series of 2 webinars on navigation services. The second webinar on providing navigation services for clients with serious mental illness and chronic physical health conditions will be held this coming Monday, August 28th at 2 p.m. Eastern. Today's webinar is going to be interactive with 50 minutes of presenter-led discussion, followed by 10 minutes of presenter and participant discussion. There will be an opportunity for questions and answers at the end of the webinar, so please submit your questions to us using the chat function. A copy of the slides and a recording of the presentation will be made available at resourcesforintegratedcare.com. Next slide. The Centers for Medicare and Medicaid Services is accredited by the International Association for Continuing Education and Training. The Centers for Medicare and Medicaid Services complies with the ANSI IACET standard, which is recognized internationally as a standard of excellence in instructional practices. As a result of this accreditation, the Centers for Medicare and Medicaid Services is authorized to issue the IACET CEU. Next slide. To earn continuing education credit for this webinar, complete the post-test through the Centers for Medicare and Medicaid Services Learning Management System and score 80% or higher by midnight on September 11, 2017. More information is available on resourcesforintegratedcare.com. Next slide. The Medicare-Medicaid Coordination Office in the Centers for Medicare and Medicaid Services ensures that beneficiaries enrolled in Medicare and Medicaid have access to seamless, high-quality health care that includes the full range of covered services in both programs. To support providers in their efforts to deliver more integrated, coordinated care to Medicare and Medicaid enrollees, MMCO is developing technical assistance and actionable tools based on successful innovations and care models, such as this webinar. Next slide. This webinar is developed by the Lewin Group and hosted by the Medicare Medicaid Coordination Office, Resources for Integrated Care, or RIC. Next slide. I'd like to take a moment to introduce our 3 speakers for our webinar today. My name is Alana Noor, and I am a Federal Health and Human Services Consultant at the Lewin Group, and I will be helping facilitate our webinar today. Our first speaker is Dr. Alice Geis. She is the Director of Integrated Health at Trilogy, Inc., a community mental health center in Chicago. She is an assistant professor at Rush University, where she teaches in the master's and doctoral programs. She is board certified as a psychiatric mental health nurse practitioner with doctoral preparation in systems leadership nursing. She has held a number of clinical, administrative, academic, and consulting roles, including director of a hospital-based psychiatric home care program, member of a United Nations team investigating war crimes in the former Yugoslavia, and program development consultant. Kimberly Smathers, our next speaker, has been employed by the Lewin Group since May 2013 as a Federal Health and Human Services Managing Consultant. From 2008 to 2013, she was employed as Vice President of Business Development at Heartland Health Centers, a Chicago area federally qualified health center. Ms. Smathers leads efforts to support behavioral health organizations and providers in delivering behavioral health and other health services under the technical assistance to support providers in providing care to Medicare and Medicaid enrollees contracts with the Medicare and Medicaid Coordination Office at the Centers for Medicare and Medicaid Services. Finally, Mindy Clouden is the Director of Technical Assistance for the SAMHSA HRSA Center for Integrated Health Solutions and provides individualized consultation and training to community mental health centers, primary care clinics, and other healthcare systems and providers working to integrate primary care, mental health, and substance abuse treatment. Ms. Clouden also works on healthcare payment and delivery system reform. Prior to joining the National Council, Ms. Clouden served as the Director of the Office of Healthcare Transformation at Jefferson Center for Mental Health in Colorado. In this role, she was an advisor to executive and senior management on healthcare policy and trends, developed key health reform initiatives, and worked to cultivate and sustain interagency partnerships that support the integration of behavioral health with primary care. Next slide, please. To provide a brief overview of our presentation today, we will start out with a few polls, which we'll get to in a moment. Alice Geis will provide an overview of navigation services, and Kimberly Smathers will review RIC's Navigation Services Organizational Assessment Tool, or NAV OAT. Dr. Geis will then also discuss how our organization has used the NAV OAT to assess capacity for navigation, and Mindy Clouden will discuss best practices for implementing navigation services at your organization. We will then move into questions and answers. So to kick off our polls, let's move to the next slide. Our first poll question that you can answer now: which of the following best describes your professional area? We'll give you just another moment to answer. Next slide, please. Great. So it looks like we have a variety of professional areas represented on today. Welcome, everybody. A number of health plan management staff, as well as behavioral health, and many other areas. So welcome, everybody. Next poll question, please. Next, what is your primary role? Just another minute. Next slide, please. And again, a wide variety of roles represented today, which is wonderful, and a large number of care coordinators and managers, which is wonderful. Great. Next poll question, please. And lastly, in what setting do you work? Great. Next slide, please. And we have a number of people from managed care organizations, behavioral health organizations, and as well as federally qualified health centers and community-based organizations. Welcome, everybody. Next slide, please. To review the learning objectives that we have for today, upon completion of this webinar, you will be able to understand the importance of navigation services in providing integrated care to clients managing mental illness and/or substance use conditions, recognize the organization's ability to provide navigation services using the NAV OAT, and identify concrete next steps for expanding organizations' capacity to integrate navigation services. Next slide. And now I will pass off the presentation to Alice Geis. Alice, please go ahead.
Hi, I'm Alice Geis. Thanks for being part of the webinar. I look forward to your questions and discussions at the end. First, so we get on the same page, let's have a quick definition of what we mean by navigation in the healthcare setting with more detail to follow. So briefly, navigation is the process of helping clients obtain high-quality coordinated care through linkage, advocacy, education, and attention to wellness. Navigators overcome barriers to care through one-to-one working relationships with clients and developing relationships across the care team. I'm actually still on the last slide. While some of you may not have individuals with job titles of navigator in your organization, it's likely some staff are providing what we're calling navigation services. Before we get into too much detail about the who and the what of navigation, I want to quickly consider the so what question, which is, why are navigation services important? To answer, we need to consider the population that we serve. Members of some populations have vulnerabilities that make it more likely that they will need help with navigation. This includes the population many of us serve, those with serious mental illness and substance use disorders combined with multiple medical comorbidities. The cause of this vulnerability is multifactorial. It includes common symptoms, for example, in areas such as cognition, endurance, and affect regulation, which can accompany many mental illnesses. There are different takes on what qualifies as serious mental illness, so we've included a definition from SAMHSA here. We also know that having such complex health problems can lead to bad outcomes, and some of that is tied to the barriers faced by this population. Common problems include regular health screenings being missed more often, lack of access to specialty care, or inadequate reimbursement. In addition to missing particular services, poorly coordinated care can also contribute to less than ideal outcomes. This can stem from problems in areas of medication reconciliation, information sharing at times of transition from one setting to another, or inadvertent overlap of services, such as when individuals are seeing multiple providers of the same type or receiving conflicting provider input. Next slide. To deepen our understanding of navigation, I'll call out some of the aspects of the role and the activities of a navigator. The actions of a navigator are important, but central to the role is relationship with the client. Many of our clients have had challenging experiences with the healthcare system. For example, involuntary hospitalizations might have started in a way which was traumatizing to a client, or lack of provider understanding of mental illness might have led to years of suffering without adequate treatment. In any case, relationships must be built across the care team, but all of that coordinating capacity might lead to failure without a central focus on the working relationship with the client. This becomes important when we talk of a navigator providing linkages. A warm handoff involving a trusted person increases the likelihood of follow-through with a referral. Overcoming barriers to care can involve navigator actions, but also must include, when possible, teaching and training the client in self-advocacy, in education regarding health and illness, and the function of health systems. Increasing the client's self-reliance in these functions is key. I have a brief example. Once when I was conducting a group training in self-advocacy and discussed the topic of reporting side effects and requesting a medication change from a provider rather than just stopping the medication on your own, one client said, "You mean we can say that?" They didn't even realize that they could have that power in the working relationship. So facilitating the necessary level of communication and collaboration to provide truly integrated health care is harder than it sounds, as many of you know. Who provides these services? We'll get a little more detail about that in a minute, but the answer really depends on the complexity and type of need, the type of system, whether you are working with a service or a reimbursement focus, and budgetary constraints. Next slide. Another question that helps us understand what clients need from navigation services is, what is it about systems that can make navigation more difficult? You all work in systems. They may be larger or smaller, built of partnership arrangements or fairly self-contained, but there are elements of these systems which can make healthcare navigation difficult for many and most difficult for vulnerable populations, such as older adults or people with serious mental illness. Parts of those systems can become encased in silos which don't communicate well with other areas. You may need to communicate with other systems on behalf of your clients, but run into problems with compartmentalization. with the needed programs, equipment, medications, or services being difficult to procure due to the impact of different operational workflows or different reimbursement mechanisms. So the need for healthcare navigation emerges from these inherent difficulties. Services can be fragmented. Behavioral health services can still be compartmentalized from general health services. Licensed healthcare providers are still educated in silos. While more programs are embedding material on interdisciplinary team care, the clinical programs students learn in still sometimes lag behind in giving real-world experience working in tightly coordinated, integrated teams. And transportation or mobility problems may negatively impact clients' ability to access specialty care. Next slide. So if you provide behavioral health services, you are likely to have some or all of these team members helping provide services. I think we're missing pharmacy on this one and really the all-important family or significant others. But you get the picture. The client is at the center. Who helps the client make the plan come together instead of being a collection of parts that pull in different directions? Well, in your organization, as I said earlier, you might not call the person a navigator, but a case manager might help do this. However, once the client is participating in services external to the organization, the complexity increases, and so does the need for good coordination of care and help navigating. Next slide. I want to say a little bit more about who does which piece of healthcare navigation. Yes, nurse practitioners and physicians do healthcare navigation, though typically not the outreach or direct teaching and training elements. And if you're like most organizations, you want to right-size who is doing what, have everyone working to the top of their licenses or experience. This is why you need navigators. Otherwise, you will have people who are working at something that someone else should be doing. For example, you might have a primary care provider who should be diagnosing and prescribing treatments or medications for medical or psychiatric illness, waiting on hold to get prior authorization for a medication they previously ordered. In many organizations, RNs contribute significantly to complex care coordination. They may provide a detailed assessment of need that includes information that helps to individualize navigation services. This can include assessment of health literacy, motivation to change behavior, pertinent information from the psych, med-surg, and population health realms. Nurses often have expertise in communicating with hospital and other health systems and can advocate for clients and teach self-advocacy. Another quick example, I met with one new outreach nurse just last week who told me of a situation where she was visiting a client in the hospital, and the hospital RN stated that he was going to be discharged imminently, despite the fact that a recent blood sugar was 550, very high for you non-clinicians. The hospital staff was going over discharge instructions, asking if the client performed home blood glucose monitoring, and due to his psychiatric symptoms, the client was not reporting accurately. The outreach RN was able to provide correct information, and also an intervention, which was to insist that the attending be paged at that point. And while this intervention only bought another day in the hospital, the client did leave in more stable condition. Another group that does navigation, licensed social workers or counselors, they can provide invaluable assistance in activities as diverse as tracking availability of various community resources, integrating information about trauma history, and helping with selection and referral to psychotherapy services. Case managers, called recovery counselors, in the setting I work in, often provide significant amounts of navigation services. They help clients track appointments and medication refills. They support smoking cessation efforts and other wellness services. They might also provide support to peer staff who often do many of the same activities. Next slide. So to sum up some of the most important parts of healthcare navigation, it's important to use outreach. This gives the ability to overcome transportation, mobility, and cognitive barriers. Meet clients where they are, geographically and psychologically. Provide a client-centered or recovery model focus. Practice cultural awareness. Ensure client access to best practices, to evidence-based care when possible. Excellent communication, follow-up, and closing the loops on communication in between organizations is very important. And modeling persistence and teaching self-advocacy to clients. Now I'm going to pass it back to Alana.
Thank you so much, Alice. Next, we will move into a review of the Navigation Services Organizational Assessment Tool from Kimberly Smathers. Kimberly, go ahead.
Great. Thanks, Alana. Move to the next slide, please. To give some background, Resources for Integrated Care developed the Navigation Organizational Assessment Tool, or as we'll call it today, the Navigation OAT, with the input of subject matter experts in navigation, including Alice Geis. The tool is derived from the experience of behavioral health clinicians, primary care clinicians, and individuals with expertise in implementing navigation services with individuals with serious mental illness and substance use conditions. The tool is built upon the recognition that individuals with serious mental illness have high rates of medical comorbidities and significantly shorter lifespans, largely due to high rates of chronic health problems, including obesity, diabetes, hypertension, and other cardiorespiratory illnesses. There is a need for coordinated services for individuals with serious mental illness that recognize the interconnectedness of mental and physical health, adverse childhood events, and adult physical illness. Next slide, please. This assessment tool is designed to assist behavioral health organizations in assessing the various aspects of their organization's ability to provide navigation services to clients managing serious mental illness and substance use conditions. Specifically, the Navigation OAT allows organizations to assess the presence and the quality of elements that are necessary for navigation services and to create a path toward providing or strengthening such services within their organizations by connecting identified gaps to tangible next steps in the form of a customized action plan. Next slide, please. The tool is broken into two main sections. The first section is focused on organizational capacity to support navigation services and addresses topics such as documenting for a specific population, barriers to care and client characteristics, organizational infrastructure needs, including funding, culture, staff roles and training, partnerships, and key program processes, including care team workflows and data documentation. The second section delves into pillars of navigation support services with a focus on what navigation looks like on the ground. It contains sections on building client relationships, including cultural competence and communication practices, health literacy, health coaching and wellness planning, including support for client-centered goals and self-management, care coordination, and linkages to community services. Next slide, please. The Navigation OAT is available online through a downloadable PDF which you can print and complete, as well as an interactive Excel tally score sheet, which creates a customized action plan based on your responses. Depending on your preferred method of administering the Navigation OAT within your organization, you may find the use of either version more convenient for facilitating team discussion of responses and for having a reference to refer back to as you enact plans to strengthen navigation services. The tool should ideally be completed by at least 2 staff members within your organization. Identify several people with different perspectives, such as clinical and support staff, administration, or peer support specialists, and others. It's important to include multiple points of view. Individuals should be instructed to choose one response for each question, and you may also want to emphasize the importance of answering rating questions honestly, even if the rating is low. All answers are for internal use, and staff should feel empowered to give their candid appraisal. As you go through the tool, you may find that the organization is engaging in activities to provide navigation services, but that you refer to these under a different name or refer to the staff completing these activities by different names. It's understood that individuals with titles such as case manager, care coordinator, or peer support specialist may, in some organizations, be doing the work of what is called a navigator in this tool. When questions ask about a navigator, consider the relevant staff person in your organization who performs or will perform that function. Finally, large organizations that have multiple sites will receive the most useful responses if they ensure that all individuals completing the tool use the same scope when they answer each question. For example, you may instruct individuals to answer questions with your entire organization in mind and to select the response that is appropriate across the majority of sites. Alternatively, you may wish to concentrate on a subset of a few targeted sites in order to dive more deeply into their needs. Your choice of scope is subject to what your organization hopes to get out of its use of the navigation OAT. Next slide, please. On the screen, you'll see a screenshot of the first few questions in the Excel-based version of our tool. There's a column for responses and a column listing the corresponding section of the action plan. Next slide, please. Based on your responses to the questions, the Results tab of the Excel sheet is populated with a customized action plan that you can save, print, or copy into other planning documents for your organization. Action plan steps are automatically included if you select responses that fall in the middle or the bottom of the response scales. So for example, for the questions shown in the prior slide, action plan steps would be populated when the somewhat or the no response was chosen. Next slide, please. You can find the navigation OAT at the link on the screen. Additional resources related to navigation services are available at the second link, including our navigator tip sheets addressing the intersection of serious mental illness and common physical health issues, such as diabetes and smoking. These will be explored further in a follow-up webinar scheduled for Monday, August 28th. And now I will turn it back over to Alana.
Thank you, Kimberly. Next, we will turn to Alice Geis again to discuss her organization's experience using the NAV OAT to assess capacity for navigation. Alice, please go ahead.
Okay, thank you. You can move the slide. So now I want to briefly touch on how we administered the tool in the agency and how you might use it. So I'd recommend convening a small group, as Kimberly discussed, diverse for function. You can limit to a section of the tool because time is always an issue. So we completed part one, the organizational capacity to support navigation services section, and plan to complete the second part, pillars of navigation support services, at another sitting. You want to agree on the time frame to consider. For example, ask participants to think about the past 6 months. And I'd also encourage you to think about your framework. So, for example, rapid cycle quality improvement is one such framework, also known as Plan, Do, Study, Act, or Plan, Do, Check, Act, that a lot of organizations are using to help them do quality improvement in a fast-paced environment. So RCQI is a quality improvement method that identifies, implements, and measures changes made to improve a process or a system based on the model for improvement developed by Thomas Nolan and colleagues at Associates in Process Improvement. Next slide. So who participated? There were 3 individuals, all with different roles in the organization. The first was an RN experienced in navigation in all different agency settings, including an outreach team, which serves higher acuity clients, clinic setting, and also in the residential program. There was a program director who had experience leading teams of recovery counselors, the name used for case managers, being in charge of residential programs, also drop-in center, and managing peer staff. And then myself, the integrated health director, who I have jurisdiction over wellness and health behavior change groups provide consultation and leadership to the RN and occupational therapy groups, and develop coordination of care and wellness service provision models for the organization. Next slide. I'll talk briefly about what this small group gleaned from completing the first half of the tool. We knew that we were going to face some extra challenge with navigation due to having 2 electronic health records. Some of you may be faced with this challenge as well. And we were reminded of this in our response of usually in the question about storing, tracking, and sharing pertinent information. We do a pretty good job of this, but I was reminded that we could tweak some systems. For example, by streamlining our releases of information and looking at the frequency and audiences for shared reports. We do a lot of planning with external organizations for some transitions. For example, our Williams and Colbert class members, people we are helping to move out of nursing homes related to these consent decrees imposed on the state of Illinois. However, similar planning with acute care inpatient facilities sometimes can't happen, and we experience challenges getting timely access to acute care records. So we were prompted to take another look at that, and we've had some discussions with local hospitals about doing that, but we want to move it forward. When reviewing our score in the comprehensive curriculum for navigators item, we realized that we could provide more detail to staff on orientations and training about which navigation elements will be the responsibility of the various team members. And lastly, while we do use an integrated health assessment for those clients who receive services from an RN, not all of our clients do. So the tool prompted a discussion about how we might either make those nursing resources more available to a larger segment of the population, or use nursing to develop those plans and then pass them off to others. Next slide. Finally, the agency is still parsing the results of the assessment, but we do have some thoughts about how results can be used, and I'll share that with you. We've been looking at the new employee orientation sequence for other reasons. Sorry, I think we're a slide behind. We should be on quality improvement. Next. Here we go. So new employee orientation, we've been looking at this, and we've considered how some material about navigation might find its way into those meetings. Existing staff get updates in team meetings and in training materials uploaded onto our training software, so there is a path to getting information to them through those channels. Understanding how much navigation an organization does and which levels of employees do it can assist with communication with managed care organizations and optimization of reimbursement for needed navigation services. And last, using the OAT can facilitate taking a look at staff roles in relation to navigation and adjusting roles to best meet client needs and agency staffing patterns. So now I'll pass it back to Alana.
Thank you, Alice. Now that we've gone over your organization experiences, I would like to pass it off to Mindy Clouden, who will be discussing some best practices for implementing navigation services organizations. Mindy, please go ahead.
Thank you, Alana. So I'm going to be drawing on my experiences working in community mental health and also working with practices across the country that have been working to implement behavioral health and primary care, many of which are instituting navigation programs or looking at how they can best maximize the existing staff that they have to provide navigation functions. And, Dr. Geis talked about that when it comes to thinking about who your navigation staff are, that in many cases, many organizations have folks that have a role that includes navigation functions. And it's kind of more the exception than the rule for there to be an actual navigation department or someone whose entire role is to be a navigation staff, although those do exist within some organizations. And so really what's important for your organization if you're looking to start a navigation program is to think about the existing resources that you have and how you can best reallocate staff, or if you have funding to develop a navigation function, to make sure that you have a good understanding of what your goals are for that program and that you're aligning the way that those roles are formed to the intent of the program. So, if you think about all of the different pieces within an organization of who's touching the life of a client, you may have a nurse care manager, a healthcare coordinator, a more traditional case manager in behavioral health. Many community mental health centers have peer specialists or peer health coaches, and then there's the therapist. And all of these different roles may have some piece or part of delivering navigation services. And what's important to understand as an organization is that when you're introducing a new function, it's important to be explicit about who is going to have what kind of responsibility in terms of implementing navigation services. And there are some real pros and cons to having existing staff take on this role versus dedicating new staff to it. Obviously, there's the financial aspects, but there's also the workflow issues that come about. So if you're looking at reallocating staff, you have to have a good understanding of what will they stop doing in order to take on navigation functions. And when you're introducing the navigation role, what you're really doing is starting to move beyond just coordinating care across healthcare delivery systems or internally across behavioral health and primary care providers, and starting to introduce the idea of supporting patients and clients in accessing the services and supports that they need in the community to really address social determinants of health. And so it's a whole new kind of mindset for many healthcare delivery systems, for many organizations, to be thinking not just about how do we get folks into healthcare, but how do we improve people's health by linking them to affordable housing and to food resources and other community supports. Next slide, please. So whoever you determine will take on the navigation functions within your organization, it's important that those folks become an integral part of your integrated care team. And, I can give you a real concrete example of why this is important. If you're working with a patient on addressing diabetes, for example, and you're having trouble understanding the barriers that the patient is having to changing their diet, the navigator may have a piece of information that no one else on the team has. They may, for example, know that that patient is receiving all of their food from a food pantry, or that they're actually living in a homeless shelter and going to soup kitchens in order to be fed. And so there are barriers that they're facing in managing their lives, and those are important for the medical team and the behavioral health team to have an understanding of so that you can work together on whole person care. Next slide, please. So considering the staff that have the navigation functions as an integral part of the integrated care team also means that they're actively involved in integrated care team communication. And what we've learned in terms of best practices around integrated care team communication is that it really needs to be very intentional. And there needs to be some time dedicated to simply talking across the multidisciplines, talking together about the needs of patients that are dealing with complex health and social issues. And so the ways that we've seen effective to do this are through daily huddles, which may be first thing in the morning or may be done over the lunch hour, weekly care team meetings, which seem to be most successful if they are led by a care coordinator or other staff member who is in charge of helping to identify in advance which patients you need to be discussing within the care team meeting, and you are using risk stratification methodologies in order to really focus in so that you maximize that hour or whatever amount of time you're spending on the care team. Having shared care plans and access to a common EHR. So, ensuring that if you have folks that are responsible for navigation, that they have access to the EHR, and that you're looking at, is there a place within the EHR to actually record information that the navigator is collecting about the patient and sharing that across the integrated care team. So some EHRs need to be supplemented with care management software or databases that are developed specifically for the purpose of working to address whole health in a more coherent way. And then also having urgent communication mechanisms in place. Next slide, please. So all of this really requires a new way of thinking about delivering healthcare services and behavioral health services. And that really requires an investment in staff training, professional development, and developing core competencies. I like to talk about this in terms of developing a culture of integration within your organization. And again, because we're really talking about addressing not only healthcare needs, but health and the social determinants of health, it's important that staff have a good understanding of why. Why are navigation functions being introduced, and how is this going to benefit the patient and improve the organization and improve the organization's outcomes? Along with kind of educating folks about why navigation is being put in place, there also needs some key processes and procedures to be developed. So for example, you may be looking at how do we change or adjust our human resource policies so that job descriptions have a clear way of conveying that this is an expectation, and that staff members are not only aware of who is providing navigation functions, but that they understand how they're going to be evaluated in terms of their success in providing these functions. Training staff in team-based care, as we just talked about, becoming a part of a team and recognizing everyone's role within the team, and also training staff in cultural competency and educating staff on social determinants of health. And then when it comes to assessment and development of whole person goals, there may be organizational healthcare assessments in place. You may have already a behavioral health treatment plan. But again, when you're introducing the navigation functions, what you're really beginning to do is to look at how do we assess where this person is in their recovery process and what are their needs within the community in order to help them to get healthy and to be able to best manage what's going on with their lives. So you may need to introduce some new questions that you haven't previously asked. And those questions, as part of the assessment process, need to be within the electronic health record or otherwise accessible by the whole care team. Next slide, please. So that relates to this next slide here about developing the necessary data infrastructure. So it's important that you have in place a system for identifying patient needs as they relate to the navigation functions, as they relate to social determinants of health, and that assessment is accessible by members of the care team. It's also important that if you're going to be helping patients to access community services and developing relationships in the community with agencies that you will be referring your patients to, that you have in place the necessary releases of information, particularly if you are an organization that is covered under 42 CFR Part 2, which governs the sharing of information related to substance use disorder treatment. And then if you are making these referrals, you'll want to have a data infrastructure in place that helps you to track the success of those referrals. Did someone actually make it to the food pantry, or were they able to access that specialist? And what kind of follow-up is necessary to help support them in accessing those resources? And then what metrics will you use? So some of this may be dictated by your funding. For example, if you have a grant that's supporting the implementation of a navigation team or a navigation role, you may have metrics that the funder is expecting for you to be reporting on. But even if you don't have that in place, your organization should strategically decide what will we measure and how will we know that the investment we've made in putting a navigation function in place has actually been successful. And then lastly, as Dr. Geis alluded to, having a continuous quality improvement process in place is important to be able to measure the impact that you're having and make the necessary tweaks along the way. Next slide, please. Then it's important that if you are connecting folks to resources in the community, that you have some staff that are dedicated to maintaining up-to-date information on what those resources are and the necessary referral processes. So this can be maintained electronically, and/or it can be used as handouts that you share with both patients and staff. And I say with both patients and staff because not only are you helping directly to support the patients in identifying resources in the community and access those resources, but you're also helping to support staff who may be, for example, in a therapy session with a patient, learn that the patient is homeless and just, again, as an example, and need to be able to say, beyond, hey, we have some folks that provide a navigation function that you can connect with, they could actually right there and then say, you know what, I have this handout for you. You can take this with you, and it'll help connect you with some affordable housing resources. Some organizations actually take a helpline approach and have either during the hours that the clinic is open or maybe even an after hours call line. And that, of course, requires the investment of staff that are trained, that are able to answer the phone and help connect people as needed. Some helpline approaches that we've seen in community mental health centers are actually more for staff. So if in that example that I was using a moment ago, a therapist is right there in a session and the patient says, you know what, I just lost my housing, the therapist could call the helpline right there and then and find out how to direct the patient. And then lastly, it's important that there are resources dedicated to developing and maintaining community collaborations so that you're able to provide the patient with accurate information about referral processes, that the organizations you're referring to have a good understanding of the needs of patients with serious mental illness or substance abuse disorders, and how you can work together to improve the overall health of your community. Next slide, please. So, of course, money doesn't grow on trees as much as we would all like it to. So, the question is always, well, how do we pay for navigation services? So as I said in the beginning, if you do not have funding upfront in terms of some kind of a grant that can help you get a program started, the first place to start is assessing your existing staff capacity and to capitalize and build on existing resources. And this may require some workflow redesign and some process mapping that you use to really get a good understanding of who is currently doing what do we want to add in, and how do we best allocate those staff resources. And then in terms of coordinating billing, it's valuable to do some kind of analysis or time study to look at what exactly are we doing within the navigation function or within the navigation department, and what, if any, of what we're doing is billable. And just to use an example, I know that I've worked with a community mental health center that was providing telephonic support that they considered to be their navigation services. and it was case management. And they were trying to get their staff off the phone as quickly as possible. So, answer the patient's questions, connect them to resources, get off the phone. But there was always more that they could be talking about. And what they realized is that if they had the appropriate staff in terms of licensure providing these services, if they were on the phone 8 minutes or more with the patient, that was actually billable as a case management service. So it's important to have a good understanding of what can be billed, and if you're providing services that cannot be billed, to look at are there ways to support that through alternative payment, value-based payment contracts, or pursue grant funding. Next slide. So of course, all of this can be very challenging and overwhelming for an organization to start up. I'm going to talk about some common pitfalls. Next slide. So one of the ways that a navigation program or function can easily fail is if there's a lack of leadership or a lack of investment on the part of the leaders in making sure that this is successful. So you really do need to have support from the top down. You also need to focus on culture change. So rather than just implementing new processes and new ways of doing things, you need to be looking at how do we develop the staff understanding, how do we message about the importance of what we're doing, and how this fits in with an overall vision of the organization to really address whole health. I talked before about adequate investment in staff training and having really clearly defined roles so that everyone within the care team understands who is doing what when it comes to supporting the patient and providing that navigation function. If you have dedicated navigation team members, making sure that the staff as a whole has a good understanding of who this new person is, this new team member, what role they play, and how that can support the rest of the team. Having clearly written policies and procedures, adequately investing in documentation and use of data, and investing in community relationships is all really important. And then poor communication can really be a downfall, both internally and externally. So internally, again, the care team needs to understand the new function, the new role, and externally, the partners that you're referring to need to have a good understanding of the needs of the patients you're serving and what your organization does and how you're looking to partner with them. Next slide, please. I did just want to mention that the Center for Integrated Health Solutions, which is funded by SAMHSA and HRSA and is administered by the National Council for Behavioral Health, is available to provide an individualized consultation to behavioral health and primary care providers that are working to integrate care and also to implement navigation services. And now I'm going to turn it back over to Alana.
Thank you, Mindy. So now we have time for a few questions. If you could enter any questions that you have into the chat function as well. And we'll start with a question for Alice. What are some ways that navigators can teach self-advocacy to their clients?
Okay, I can tell you how we've done this. We conduct individual and group psychoeducation, and we, for example, one way we've done this is we have master's level psychiatric or public health nursing students intermittently at the agency, and they do health talks in the drop-in center, which frequently include this content, may involve role play or other information. I've done a psychotherapy group which addresses clients' difficulty, asking for what they need and advocating for themselves. But the bulk of this is done by the case managers and the registered nurses who often model the behavior that they're trying to help the client learn. So they may be calling about referral authorization or just even trying to reach a physician or a nurse practitioner and do that with the client so that maybe next time the client can do it with the staff there or ultimately do it independently. So I hope that answers your question.
Yes, thank you, Alice. That's really helpful clarification. Another question for you. Do care coordinators fit into the group of caseworkers and care managers?
I'm not exactly sure how to answer that. I guess it depends on what those job titles mean in your organization. I think they have proliferated. So care coordinators, care managers, caseworkers, case managers. I think the important differentiating feature to me is really what is the primary mission of the individual. So I think provider organization-based individuals may have a slightly different framework from reimbursement or MCOs, for example. And both kinds of organizations may have people with this title. So I think, yes, they are doing many of the same things in terms of linkage to services, hopefully putting, prioritizing needs in terms of some real world or whole person priorities, such as housing needs to be accomplished in order for someone to have a stable base of operations in which to access the rest of their needed services. But I think it's not so much the name of the person, but what kind of system that they're working in and what their primary focus is.
Great, thank you. Okay, so we have time for one last question. And as a reminder, if you have any additional questions that we weren't able to get to, please feel free to email us, ric@lewin.com, and we'll follow up with everybody after the webinar as well. So the last question, this is for Alice or Mindy. Briefly, give an example, maybe if there's a diabetic client who's non-compliant with meds because of psychoaffective disorder that this particular client isn't able to address, how would you suggest you would help this man help himself?
Mindy, you want to go for this one, or shall I?
Well, I'll offer a few comments. So that, the first thing that I think of is I think you want to have a reframe of, rather than thinking of non-compliance, think of what are the barriers that this patient is having to compliance. And so it's a matter of, making sure that you're using motivational interview skills, that you're having the right person have the conversation with the client about what's going on with them. It may be that utilizing a person in a peer role to kind of draw out, what's going on and how can we help support you, and let's set some small goals, some reachable goals. I think that, the navigation function, just as I talked about in my presentation, in terms of thinking about what does this person have access to in terms of healthy food, do they have refrigeration if they're needing that for insulin, making sure that you're looking kind of at the big picture of what's going on with the patient.
Thank you, Mindy. And I'd also like to add that we will be covering a lot of related topics to this type of situation in our upcoming webinar on Monday as well. So we'd love to have you join us there again. Thank you, everyone. That brings us to the end of the webinar. If you could please complete our brief evaluation of the webinar so that we can continue to deliver high-quality presentations in the future, that would be wonderful. If you have any questions for us, please email us at ric@lewin.com. And for more information about obtaining continuing education credits, there's more information on, resources for integratedcare.com. Thank you so much for joining us, and everyone have a wonderful day.